I am so delighted to introduce Chavon Ford. She'll pop up on the screen in a second, hopefully. There she is. Hello, Chavon.
Hi.
Oh, you're on mute. No, you're not. Hi, how are you? Oh, you're on mute, Chavon.
Okay, there we go. Can you hear me
There
now?
we go. Yes, I can hear you now.
Okay. Is this?
Thanks so much for joining us. I'm going to introduce you briefly. Please give yourself a fuller introduction. But Chavon has an MSc in clinical herbal medicine. She's a doula and a trainee midwife. I think you recently moved to Dar es Salaam. I'm not sure how long you've been there, but you came from Tennessee. Is that right?
Well, yeah, Tennessee. Yep.
Well, please feel free. Take it away, Chavon, and I'll come back to you in about 40 minutes.
Okay, awesome. I have a presentation prepared, so I'm gonna share my screen. So let me know if you can see it. Hold on.
Yeah. Okay. Great earrings, by the way.
Thank you. I got these here.
They're really nice.
Thank you. All right, let's see. All right, bear with me, guys.
It's okay. It always takes a few seconds.
Yeah, let's see. Okay. Oh, okay. So, hold on. Uh-oh. Is this screen already sharing?
I can see Chavon Ford and I can't see you. I don't know what we should have.
All right, it's saying I don't think it's up there yet. Hold on 1 second. Looks like it's loading for some reason.
Well, while it's loading, how long has your shop been open?
Well, we opened up the shop here in Tanzania in May of this year, actually. So it's been about 4 months now. But we had the original shop in Nashville, Tennessee. We had that shop for about 2 years. And then we moved to Dar es Salaam in 2020, in October 2020. So we've been in Dar for almost 2 years now.
Okay.
So it's been really nice, yeah. Okay.
And what made you decide to move from Tennessee to Dar?
Oh man, there's so many different things. First of all, the pandemic was like the major, one of the main reasons why we left. Just things had become really, really bad for those of us in America, just with all the lockdowns and the civil unrest and the social unrest. And so we were like, we just had our son, and we didn't want to raise him in that sort of environment. So we decided to move to Tanzania, and that was when Magufuli was here. And so there wasn't really any restrictions here, and we were like, man, that's where we need to be.
I think we're here for the same reason.
Yes.
It's your PowerPoint. What's the first slide in your PowerPoint?
There should be a picture of me, just a picture of me, and the title of it says Women's Health. Yeah, but what's going on now?
It's not coming up here.
Yeah. Okay, so this is what I need to do. I have to save this to a different way. Give me 1 second.
Okay.
Sorry, guys.
Don't worry. So while Chavon's just working out her PowerPoint, I'll just remind everybody the purpose of our conference is to raise money so that we can build a functional medicine health facility. And the obvious place to do it, I don't know if you heard Jeremy earlier say that using traditional and alternative medicine is enshrined in law in Tanzania. So it's the obvious place for us to do it here because we are welcome. And there might be some red tape, but my meetings with the Ministry of Health so far have been very positive. So I'm really, really, really looking forward to getting to the next stage. And this is really to introduce alternative medicines to people suffering chronic illness and autoimmune disease, because they lose hope, because they are, patients are told, we can only control your symptoms, we can't really cure you. And we know that that's not the case. So that's what this conference is all about. That's what the Health Village will all be about. And I'm really looking forward to sharing details of that with everybody in the next few months. How are you doing, Chavon?
Awesome. So is it up yet?
No.
Oh man. Okay. I have it. Okay, so I'm hitting share my screen.
Kiara, maybe you could jump in and help Chavon.
Let's
Just
see.
tell her what to do, explain what to do.
Okay, is it up now?
So it says Chavon has started screen set. Yeah, we got it. Here we go.
Okay, awesome. Sorry, y'all.
No
sometimes
problem.
this technology gets the best of me sometimes. Okay, so here we are. As Sally mentioned, my name is Chavon Ford. I have a master's of science in clinical herbal medicine. I went to Maryland University of Integrative Health in the United States. So currently I'm in Tanzania, CEO of Ford's Herbal Wellness Center, which is down in Dar es Salaam at Shoppers Plaza. And I'm also founder and teacher at Ford's Herbal Medicine Academy. So just a little bit of myself. So my talk is going to be on women's reproductive health. So I want to first just start talking about the state of healthcare, more specifically the state of women's reproductive healthcare. So according to the World Health Organization, 71% of all deaths globally are the result of non-communicable disease, which is just basically a fancy name for chronic disease such as stroke, heart disease, diabetes, chronic inflammatory conditions, so on and so forth. So approximately 600,000 hysterectomies are performed in the United States. So that's a pretty large number, but when you break that down even further, it comes up to one womb is removed, I like to say snatched out of a woman every minute of the year, which is absolutely astonishing. Also, mothers and infants born to Black people, Black women in NHOPI, which is basically an abbreviation for Native Hawaiians and Pacific Islanders. Infants and women in these categories are 2 to 3 times more likely to die compared to other populations of women. So I like to delve a little bit further into the history of women's reproductive health, because I strongly feel that in order to understand the present and the future, we must first understand the past and the history. So women's health in the West, in America specifically, started off in the early 1800s. So in 1927, the US Supreme Court decided by a vote of 8-1 to uphold a state's right to forcibly sterilize a person considered unfit to procreate. There was a famous case known as Buck versus Bell, which centered on a young woman named Carrie Buck, whom the state of Virginia had deemed to be feeble-minded. This is also where the term imbecile comes from. I know many of us in the West are familiar with the term, oh, he's an imbecile, but this term was originated during this time in the century when the procedure of eugenics was started. So as many as 70,000 American women were forcibly sterilized during the 20th century. The victims of state mandated sterilization included people like Buck who had been labeled either mentally deficient, as well as those who were deaf, blind, diseased, minorities, poor people, and promiscuous women. Eugenicists looked at evolution and survival of the fittest, as Darwin was describing it, and they believed that they could help nature along if they just planned who could reproduce and who could not reproduce. So there's a lady here who I have a picture of. Her name is Margaret Sanger. I like to call her the mother of eugenics because that's what she is. And so in 1930, the Supreme Court case was in 1927. So after the Supreme Court case, there was a series of laws and policies that were passed down that had to do with sterilization and eugenics. And so Margaret Sanger started a project called the Negro Project. And, on the surface, it sounds good, like, oh, the Negro Project. But the true agenda of the project was to enforce the policy of eugenics, which is them determining who could and could not procreate, as well as the processes of forced sterilization, birth control, and abortions. So these clinics sprang up all around America, and they were part of what was called the Negro Project. So moving further along, we get to the field of gynecology. So a gentleman by the name of James Marion Sims, who's deemed the father of gynecology, he was a doctor, and what he did was he would do research on enslaved Black women without anesthesia, and he did many horrific surgeries. So what he did was he went around to different plantations, and he would ask the plantation owners if he could buy a couple of the women there who were of childbearing age, and if he could perform experiments on them, and he would clothe them, and he would feed them, and he would house them in exchange for the experimentation. And so he had about anywhere from 4 to 7 women that he kept on rotation, and he will repeatedly do different types of experiments on them, very horrific experiments where he would cut into the womb, perform various surgeries. There was one lady, because he has an autobiography out, and there was one lady who he had done 30 of the same surgeries on her, which was the repair of the rectum that's torn sometimes when you give birth. He did 30 surgeries on her just to, he would keep doing it to practice his technique and to make it more efficient. And in 1876, he was named president of the American Medical Association, go figure. And in 1880, he became president of the American Gynecological Society, which is an organization he helped found. So, there's a book here called Medical Apartheid by Harriet Washington, which I strongly suggest everyone read. And it's basically a book on the dark history of medical experimentation on Black Americans from colonial times to the present. And it's a really great read, and it talks also about how gynecology was formed. So now that we kind of have like somewhat of a background and history of gynecology and women's reproductive health as it relates to the West, we can probably all agree that it's time for us to take our control back, specifically as it relates to our reproductive health, and begin to learn the measures and the practices that we can use to make sure that we're in tip-top shape. So the 3 tenets of health are diet, lifestyle, and herbs. So starting off with diet, these are the recommendations that I recommend to women. I have a lot of women who come to me for different issues such as fibroids, endometriosis, infertility. And one of the main things that we address is the diet. So many of the women are on the SAD, the standard American diet, which consists, largely of processed foods, fried foods, refined sugars, white breads, white rice, soda, just all the things that we know that aren't good for us, a lot of fast food. And so I encourage them to switch over to a whole foods, plant-based diet. And that alone can cause some really, really great changes within the person. Also, the philosophy of using food as medicine routinely, because I believe that prevention is much better than treatment. So when you can prevent something by using food as medicine, by cooking with spices and herbs and whole foods, vegetables, fruits, grass-fed meats, organic, you begin to trigger your body to go into a state of optimal health, and you're entering into a state of prevention. So that's really ideal to get to that place. Also, making sure you're drinking enough water, of course, depending on your body weight will determine how many glasses of water you would need. Drinking herbal teas in exchange for sugary sodas and sugary juices as well. Opting for organic and grass-fed meats as much as possible, because we all know the detriments of GMO, genetically modified foods, which can turn genes on and off, and which can cause hormone disruptions and a host of other complications within the body. So, I try to educate them on that as well, reading the ingredients on the back of foods and drinks as well now, because even water now has added ingredients. So how important it is for them to read the labels, because just because something is labeled as 100% natural or all natural, or it's made with lavender, oftentimes when you read the back of the label, it has nothing natural in it at all. In fact, there's a bunch of different ingredients on there that you can't even pronounce the name, that are synthetic chemicals that have been added to the food. And so it no longer resembles its original state or its raw state. And I try to educate them to try to eat foods in its most rawest form as possible. That's usually a good rule of thumb when choosing foods. Also, maintaining a healthy weight is very important. Obese women have a harder time of becoming pregnant just because they have higher levels of leptin, which is a hormone which can cause disruption to other hormones such as estrogen. Also eating seeded fruits, because in America, there's so many seedless fruits and vegetables. I mean, it's almost a travesty. Everything is seedless, which is not good for you. It's genetically modified. Nothing that's supposed to have a seed in it should be seedless. So I encourage them to eat apples, bananas, oranges, strawberries, raspberries, some of the more tropical fruits such as mangoes, guava, and the fertility favorite, pineapple. Pineapple is really good if you're trying to become pregnant, because it helps the embryo implant into the uterus. So all of these seeded fruits are good sources of fiber, and they're a good source of vitamins and minerals. Also dairy in moderation, because everyone loves dairy. So I try not to wean them off cold turkey. So if they can just take it in moderate amounts, and if they can begin to switch over to plant milks, coconut milks, almond milks, different nut milks is also going to be beneficial. And also, America is a very coffee heavy country. Everyone loves Starbucks and a cup of Joe in the morning, which is not bad in moderation, but I do encourage them to switch over to hot herbal teas in the morning with lemon when they can, to prep the gut and to get the acids and everything flowing in the gut properly before they begin the day. So moving on to herbs. So there are quite a few different herbs that are very beneficial for women's reproductive health. So I've listed a few here. You have yarrow, dong quai, raspberry leaf, nettles, which is really good for iron. A lot of women are deficient in iron. Motherwort, black paw, lady's mantle, wild yam, and chaste. Chaste is also what they use to make the medication Vitex, which is used to help regulate hormones in women. So all of these herbs are specific to the uterus. They're anti-inflammatory, antioxidant, and they also are regulate hormones and normalize hormones. Because one of the reasons why endometriosis can flourish in the body is due to hormones being off. So when you have these herbs that can help to regulate the hormones, it's very beneficial for endometriosis. So I usually will either do a combination of herbs as a tincture. Tinctures are, for me, are the easiest way for me to prescribe herbs for my clients, just because it's easy to take. You just, whip out the bottle. You can take it, put it in your purse, so it's easy to take throughout the day. You just whip it out and take a dropper full, usually 3 times a day. And so I usually prescribe tinctures for herbs. And then there's an herb called cramp bark that I use for dysmenorrhea, which is just a fancy word for painful menstrual cycles. So I'm going to talk a little bit more about cramp bark, because cramp bark was the herb that introduced me into herbal medicine when I was not an herbalist back in the day, some years ago. I suffered from fibroids and from really painful menstrual cycles for a very long time. And I was, my mother, she just gave me Advil and Motrin because she didn't know any better, as most of us didn't know any better. So for a point in time, the Advil and the Motrin was good for keeping the cramps at bay, but after a while they did not work anymore. And so I was like, something's got to give. Like, there has to be a way for me to manage this with a natural remedy. And so that's when I discovered cramp bark. And so the scientific name for cramp bark is Viburnum opulus. It's native to Europe and Africa. The bark of this plant contains methyl salicylate, which is a weak-acting precursor to the salicylic acid that is used in aspirin, but it's gentle to the stomach mucosa. It's also an antispasmodic. It relaxes the uterine tissues. It's great for menstrual cramps, and it's also really good for postpartum contractions as well. So the reason why I try to get women to switch over to cramp bark as opposed to using the NSAIDs such as ibuprofen or Motrin is because NSAIDs can increase the risk of gastrointestinal bleeding, and they also can increase the risk of heart attack and stroke. So, and they're also really toxic for the liver if you continue to use them over time. So I really, really use this herb quite a bit. Also, this is also helpful in endometriosis as well, because the antioxidants in cramp bark can help with that condition by reducing the lesion size. So for anybody that doesn't know what endometriosis is, it's basically when the tissue inside of the uterus grows on other organs in your body. And it can be very, very, very painful. So lastly is lifestyle. So some of the lifestyle recommendations that I would recommend to my clients when we're doing a herbal consultation is reducing stress, because we know that cortisol disrupts hormones. So if they can find some other activity that they can do that will bring them happiness, such as maybe taking a walk outside, going to the beach if they're in a coastal region, massage is really good. Getting their nails done, getting their hair done, pampering themselves, getting a pedicure, which can also be medicinal as well. Singing, reading, meditating, stretching, all of those different things can help to reduce stress and improve the quality of life. Also switching over from plastic containers, especially with different skincare products. If they're liquid, if they're in a plastic container, I try to get them to switch over to metal. So anything from like stainless steel, gold, copper, silver, which is, that's not really too common. Usually can find things in stainless steel or glass. I encourage that because we know also that BPA in plastic is very harmful to health as well. Also birth control. Birth control can be really, really detrimental to the woman's reproductive system, especially with the hormones. So I do try to encourage alternative forms of birth control, such as using condoms, the pull-out method. I know that can be controversial, but it does work to some extent. Also, neem is a good birth control agent. It's a spermicide. So I encourage that. Also, sleep. Many of us sleep, but we're not sleeping properly. And I know that's kind of funny. Like, how do you not sleep properly? You just lay down and go to sleep. But there is in a sense, a correct way to sleep. So I educate them on how to sleep properly, which is sleeping in a dark room where all the lights are turned off. And that includes the TV. A lot of people like to sleep in front of the TV, but the blue lights and the red lights from the TV can disrupt REM sleep. It can disrupt brain waves, and it can make your sleep not regenerative. And we know that repair happens while you sleep. So sleep is very, very important. And also getting the correct amount of sleep is important as well. So there's different herbs that people can take to facilitate a sound sleep as well, such as lavender and passion flower are really good for sleep, as well as valerian as well. Also getting active, making sure that you're maintaining that healthy body weight so you don't put yourself at increased risk for infertility is very, very important. And also, I do try to recommend that if they can, that they can switch over to medicinal baths instead of showers when possible. Because you can make a bath very medicinal. You can add different herbs that are specific to the uterus. You can add different oils. You can add salts, and you can really detox the womb really well in the bath. So I do encourage that as well. And then lastly, I encourage vaginal steaming or yoni steaming, however you want to say it. This is an ancient practice that cleanses the womb, regulates the menstrual cycle, eases the pain of period cramps and bloating, and it aids in healing and soothing after childbirth. And it can also be very meditative, so it's a great form of self-care. It can also help to shrink fibroids as well when done over time. It's also useful for hemorrhoids as well. So a lady actually, this box that I have a picture of, we actually make these boxes. My husband does. They're called yoni steaming boxes. And a lady bought one from me actually last week, and she told me she actually uses it to steam her face. So it does have multiple uses. You can steam, I guess, anywhere really, wherever you need detoxing at. So again, the practice of yoni steaming is an ancient practice. And so I want to share this video of how they use steam in Afro-Colombian culture.
Chavon, we can't really see the video. It's just like a little box in the middle of the screen and we can't hear anything.
Okay, let me try to see what's going on. I don't know why the sound isn't going. Hold on. Still no sound.
No sound.
That's interesting. Okay, well, let's move on to the next slide. I'm not sure why the sound isn't playing. Maybe we can, it's only 30 seconds, so maybe we can just watch it just to kind of get an idea.
Yeah, anyway, let's go on to the next one.
Okay. All right, so also, steaming has also been done in TCM, traditional Chinese medicine as well. So I'm going to try to play this video. Let's see. Hopefully this one does better. Nope, still no sound. All right, give me 1 second, guys. Let me try something. All right, let's try something else. 1 second, guys.
So Chavon, someone in the chat has said you need to
Yes.
stop sharing and then start sharing again using the three buttons to share. And then the fault occurs because you elected only to share the screen, not to share the sound as well.
Okay, let's do that then. 1 second. Okay, share content. So I should hit share. I see screen, photos, iCloud, and Dropbox.
Okay, so it says here you need to stop sharing, then start sharing again. The 3 buttons to share the sound to. The fault occurs because you only have share screen and not share the sound.
Okay, maybe if I go to meeting settings, let's try that. Stop incoming video. Okay, done. All right, let's try it one more time. Let's see. All right, let's go back. Let's see. Looks like the sound still is not working. I'm not sure why.
No.
Okay. All right. Well, that's fine. So this theme is using Afro-Colombian cultures, and so this video was just a midwife who shows a midwife steaming her client after birth to clean out the womb. It's also used in traditional Chinese medicine, and this was just a video of the emperor getting steamed on his throne. So there's many different applications, different cultures that use vaginal steam. In Western medicine, it can be quite frowned upon to use vaginal steaming, but it is a very effective remedy. So as along the topic of taking back our health, we currently have Ford's Herbal Medicine Academy has a course out now that'll start on September 30th. And it's on herbal medicine and product making. And it's a 5-month course. So if anyone is interested, you can enroll up until September 23rd. So yes, if you guys have any questions.
Thank you so much, Chavon. I'm sorry about that. What we can do is if you can send me the links to those 2 videos, when we upload to the YouTube channel, we'll include those 2 videos.
Okay, yes, I'll do that.
So people can people can watch them. So apologies everybody who's watching. So yeah, a couple of questions.
Okay.
How do you use the steaming box? What do you actually do?
So basically what you do is the box has a lid on it, so it can open and shut. So what you do is you'll boil some water, and depending on if you have like roots, if you're using roots and bark hard materials, then you'll want to boil the herbs in the water as well. But if you're using just like flowers and aerial parts, you'll boil the water first, and then you'll add the herbs and let it steep. And then you'll just take the pot, whatever pot you're using, and you'll set it inside of the box, close the lid, and then you'll get a blanket and you'll sit down on the box, and then you'll wrap your lower body in the box in a blanket. So you're kind of creating like a tent, steam tent on the bottom. And then you just sit there and you can do, different things. You can read, you can pray, you can meditate, you can just think. And you sit there for anywhere from about like 20 to 30 minutes. And you can do it twice a week. If you're trying to conceive, then you don't want to do it when you're ovulating.
And obviously you have to make sure that the steam's not so hot that you don't burn yourself.
Yes, exactly. So you can also put a pillow. We also you can make a pillow with like a cutout in the middle. And so you can, if you want, if like the box is too hard for you, you can also put a pillow there as well.
Okay. And it was interesting what you said in the beginning about the hysterectomy, 600,000, one a minute, essentially. We did a little post on our Instagram page of a lady who had had a positive smear test, and she was booked in for surgery. And before she had surgery, she was treated with naturopathically, and one of the treatments, apart from vitamin C and vitamin D, it was also tampons soaked in coconut oil and Lugol's iodine.
Yes.
And she'd progressed, despite treatment, she progressed from stage 1 to stage 3. But after that, after the natural treatment, her cervical cancer disappeared, and she didn't have to have the surgery. So in your experience, what's the most common cause of women being told they need hysterectomies, and how much is avoidable, do you think?
Oh man, I actually know a lady who just had a hysterectomy here in Dar, and honestly, I think the doctors just become fed up and they can't treat it because she was having complications for a while. You know, she was having hot flashes, which is, some of this stuff is normal, but she was having like hot flashes. She was having pain. She was having pain during sex. She was having spotting, and nothing that they were prescribing her was helping. And so I guess I think they just kind of get fed up with people coming in and out, and they just say, just take it all out, you know, so we can just be done with it. Because there's so many different alternatives to just removing someone's womb. That's quite extreme, and I don't know why it has become normalized, but it's quite extreme. There's many different remedies you can use, like you said, like you mentioned with the tampons. You know, that can be very effective. You know, with the coconut oil, and even if you add some different herbs to it, like lavender, rosemary, tea tree, that are antiseptic, that can help with different inflammations and different cancers. So honestly, I just think that they just get fed up with it, and they're trained gynecology. They're really surgeons. They're trained to do surgery. Like even with the births, when you go to the hospital, and you know, if you're in labor for too long, or if you're not progressing the way they want you to progress, the first thing they want to do is cut you open and give you a cesarean section. Many doctors have not experienced a natural birth in the hospital. They just haven't. They're quick to use surgery because they're trained to do surgery. So I think that's why they're very happy to do hysterectomy.
Yeah, that's really interesting, because birth can be so different. You know, I've had 2 children. First one was textbook, 0 to birth, 10 hours. The second one was on and off for 2 days.
Yeah.
And yeah, it was so different, but there was no intervention needed, I would say.
Yeah.
So it would be really nice to be able to get that message out there of the different types of births that people experience.
Yeah, like even with me, with my second child, she was actually 3 weeks late, and that's unheard of. You know, if I was in America, they would have immediately given me a C-section, or probably called the Child Protective Services on me. But she was almost 3 weeks past due. I mean, you know, the due date is just an estimate. So she was fine. I had her naturally. I was in labor for almost 24 hours, and I had her vaginally, no tears or anything. She was 8 pounds and 4 ounces. But if I was in America, that would have been a completely different set of circumstances. You know, so I do think that a lot of times doctors' choices are influenced by insurance companies, and by trying to cover themselves from malpractice suits and everything. So if they can monitor you and they can, you know, just get the baby out of you, it's oftentimes easier than allowing birth to progress naturally.
Why would Child Protective Services have been involved in a birth going over time?
Because so if they would have taken me, so with my first child, he was also a week late. My baby just liked to stay in for longer, but he was a week late, and I was scheduled to do a home birth, a natural birth. And my midwife told me that she would not be able to deliver the baby for me at home because it was against the law in Tennessee. And so I had an option to either do it at home, or I had the option to either go into the hospital. And if I did it at home, technically it's against the law to have the birth at home. So even if I would have went into the hospital as well, and then if I would have tried to discharge myself, they can consider that to be a form of abuse and neglect. So I know I've heard cases where people that I know actually who went to the doctor that they thought they were in labor, and the doctor said they were in labor, and they were like, they were going to go home, and they were followed home by the police, and they were arrested, and they were forcibly had a C-section. They were forced to have a C-section. So it's all sorts of crazy things that happen, and government agencies are called in, and it's just a mess. It's really a mess.
Yeah, it sounds that's extra. That's I've never heard of that, and yeah, that's kind of assault, I would have thought, on the woman. I mean, earlier you were talking about healthy eating, and we had that lovely picture of great healthy food. But how easy is it to adopt a healthy diet in the West? What I've noticed since I've been here is the difference in size between people who are living here and just eating a normal diet. It's we buy food from the stall every day, every other day, and just what's seasonal. And then I see people coming on holiday from the West, and sometimes we are almost double the weight of native Zanzibaris and Tanzanians, and it's not because they're not eating. They're not suffering from malnutrition. They are eating, but just local food.
Yeah.
So how hard is it in the West to adopt a healthy diet?
It's I would say it's as hard as you think it is, because for some people, especially people who experience severe health scares, like people who are diagnosed with cancer or some other sort of terminal illness, for them, it's much easier for them to adopt a healthier lifestyle, healthier eating habits, because they're on the cusp of sometimes death, depending on how bad the situation is. But for people who are just like relatively, healthy, they don't really have they may have certain health issues, but it's not anything that's like life or death. For them, it can be harder because there's not really an incentive for them to give up certain ways of eating and certain destructive habits. But I find for the women who are dealing with infertility, for them, it's quite easy for them to give up certain things for most of them, not all of them, for most of them, because they want so badly to have a child. And oftentimes they've been trying for many years unsuccessfully. So they're willing to do whatever. And I'm like, listen, you have to make a commitment to yourself. No one is going to be able to do this for you. No one's going to be able to change your diet, change your outlook on life. Really, it's about a mental rewiring first and foremost. No one's going to be able to do that but you. And so they really have to take charge of their own health. So, it just really just depends on the individual and how bad they want whatever it is that they're working towards.
Yeah. You were talking about cramp bark. Can we buy that in the West? What do you need to ask for if you go to the health food store?
Yeah, so you can actually buy that in the West. When I was in America, they sold it at Whole Foods Market, and there was also another store that's in America called the Turnip Truck that they sold it at. But they also sell it on Amazon and some of the other big websites. There's a brand that I like to use. It's called Herb Farm, PHARM, and they sell a line of tinctures that are really good, that are organic and sustainably harvested and ethically sourced. So I really like that company, Herb Farm, and I always recommend them, as well as a company called Mountain Rose Herbs.
And it's just called cramp bark, is it?
Yeah, just cramp bark tincture.
And for the other end of the spectrum, what's good for menopause for hot flashes and hot flushes, as we call them. I know I had a homeopathic remedy, and I used to think that it wasn't working till I stopped taking it.
Yeah.
But it literally got rid of my hot flushes. I think it was about 10 days.
Yeah.
So what can you use in herbal medicine for menopause and hot flushes?
So there's actually a Western medicine called Vitex. Are you familiar with that?
No, how do you spell it?
Vitex.
Okay.
Yes. So they basically isolated excuse me, some constituents from the herb chasteberry. It's called Vitex chasteberry, but they sell it. A lot of the doctors actually prescribe Vitex, and it helps to regulate hormones. But the herb itself is called chasteberry, so you can take the herb itself as well. They sell it in pill form, powder form, tincture form, all the different forms. So that's really good. And also there's another herb called wild yam, which also helps with hormones that are really like the cause of a lot of the menopause symptoms.
Yeah, and I now you said wild yam, I'm pretty sure that even our doctors back home know about it, and it is used as an alternative to HRT. And while we're on the while we're on the subject of HRT, you know, what are the downsides of taking HRT?
What is HRT? What does it stand for?
Hormone replacement therapy.
Hormone replacement therapy. Okay, repeat your question.
So usually for menopause, women in the UK are prescribed HRT, hormone replacement therapy, which is what it says, you know, just giving you the hormones that your body's not making anymore. And it helps with headaches and sleeps and mood. And a lot of women swear by it, but your body's presumably going through menopause for a reason. And I just wonder what the downsides of taking HRT might be.
Yeah. I haven't really studied that too much, hormone replacement therapy, but just from the sound of it, it sounds like it wouldn't be something that would be very beneficial, because I imagine that once you stop taking the hormones that you may experience the same sorts of things. I don't know, maybe you have to stay on it for a longer period of time. But the good thing with herbs is that it works with your body to get it to function naturally on its own, you know. So you know, if they're prescribing Vitex or hormone replacement therapy, they would do well to just prescribe the actual herb, because the herb is smart, and it'll down regulate itself if it's producing too much hormones. It'll up regulate itself if it's not producing enough. So it regulates itself so that you're not getting too much or you're not getting too little of whatever hormone that is acting on. So I always, you know, I'm a proponent of using the whole plant and not isolates of it, like a specific chemical isolate.
Yeah, we were having that discussion earlier and saying, you know, plants are so finely balanced. So once you've got isolates, you need another pill to counteract the side effects of the pill. And then, you know, you end up with a circle of about 5 to a dozen pills just to control the side effects. Someone's put in the chat that Nikita Stark has a lot of information about births. She trains doulas and also does antenatal classes for mums. The Awakened Pregnancy and Birth chat on Telegram also has a lot of information from a wide variety of mums. Some amazing videos, when push comes to shove.co.uk. That's a great website name. If you're not aware of that one. Where else is good for women to go for natural advice on women's issues and pregnancy and the birthing?
I always try to get women to go to midwives as opposed to gynecologists, just because midwives are usually, whether it's a nurse midwife or a certified professional midwife, I don't know what the terms are in England, but in America, those are the terms for the different classes of midwives. And I find that they're more holistic centered, and they're more likely to have you to listen to and to achieve the birth that you desire. So, you know, a lot of women are getting away from going the gynecology route because oftentimes they pressure you into getting inductions in cesarean sections. And if you've had one cesarean section, they want you continue to get cesarean sections, even though many women have been able to deliver vaginally after cesarean section. So I find that midwives are more holistic minded, and they have like my midwife that I use in America. She, I didn't take any medication at all. Everything that, like when we did my blood work and my charts and everything, like if I was low on iron, she would prescribe an iron whole food supplement that I could take. When I was low on vitamin D, she had me take some natural form of vitamin D3 drops. She told me about different foods that I could eat that would help with iron, like sweet potato leaves and hibiscus and different things. So everything was just very natural. And she recommended different prenatal classes for me to take so that I would know like the different stages of labor I was in, how my partner could help. And she had a doula on her team. So everything was just like very natural. So I do recommend. And then midwives, they also do other care. So they can do a pap smear and other sorts of women's care as well. So they don't just, you know, specifically work with pregnant women. So if anyone has access to a midwife, I definitely recommend that. And a lot of them are covered by insurance as well, especially the nurse midwives. So you can use your insurance when you go to them as well. There's also different sorts of women you can go to, like doulas. They have, depending on what type of doula they are, if they're a birth doula or a postpartum doula, they can help you with different things. What else? Yeah, I would say midwives and doulas would be a good form of alternative information.
Well, that's interesting. So for people who don't know, what's the difference between a midwife and a doula?
So the difference between a midwife and a doula is that a doula is not actually certified to catch a baby, to deliver a baby, whereas the midwife is. So the doula is there to provide more emotional support and to make sure that you achieve your birth goals and your birth outcomes as much as you can. Because of course, if there's an emergency, then you may have to scrap your birth plan. But she's there to really provide comfort and support, and she can do massage. She can train your partner to do massage. That'll be helpful when you're in, you know, having contractions or waves, I like to call it. She can really be your voice of reason, like, you got this, you know, you're good. She can make you some teas, some herbal. She can help after the baby is born with, you know, if you need her to hold the baby while you take a nap or whatever. So she's just really like your, I hate the word servant, but that's really what it means in Greek. It means woman servant. So yeah, that's the difference between a doula and a midwife.
And after the baby's born, I think I used arnica or oral arnica after my second baby, and I healed so much quicker. What herbs would you use after a birth to help you heal?
So depending on how the birth goes, if you experience a lot of bleeding after birth, then shepherd's purse is really good to help stop the bleeding. Or if you're at risk for hemorrhaging, shepherd's purse is really good. Cramp bark is really great for the contractions when the uterus is going back down to its normal size. Cramp bark will really help with controlling the pain from the contractions. Also, lavender is really nice. You know, it's calming. So that's really good. Also, nettles is really good to provide minerals and vitamins to the uterus, because it's just putting a lot of work, and so it needs some nourishment. So nettles is a really good grounding tea to have as well.
After my second child, I was craving Bounty bars. I don't know if you know what a Bounty bar is, but it's coconut covered with chocolate. And I think I was eating up to 6 a day. So wow. I had some serious sugar craving. Yeah. What could I have had instead?
You know, coconut and chocolate is not bad. You know, if it's raw cocoa, you know, just, you know, pure cocoa from the plant, then that's okay. And coconut is a superfood. So I think that was okay, you know, for me, as long as it wasn't like a bunch of added sugar to it. You know, if you want to just have like dark chocolate And then coconut shreds, that's good. Also, if you want to have some sort of fruit like a mango, that can sometimes curb your sugar cravings. Watermelon is good. And some of like the higher sugar fruits would be a good alternative to a candy bar, which in your case, it wasn't a candy bar, but for anyone who is craving a candy bar, a fruit or just some dark chocolate with nuts and coconut shreds would be really good.
And our colleague is about to give birth to twins.
Mhm.
And I wonder if there's any advice that we can pass on to her for once she's given birth to her twins.
Well, congratulations, first of all. I would say to probably the hardest part outside of the labor would be the aftercare. So if you can hire a postpartum doula, I'm not sure what area of the country you're in. I don't know if they don't really have that in Tanzania, because usually the families will step in, like the grandmothers and the aunts. But if you're in the West, they usually have quite a few postpartum doulas, and they'll come to your house and they'll help you out. You know, they'll help you with like light cleaning, cooking, helping with the babies, breastfeeding. If you need, help with latching on, if you need someone to, watch the babies for a little while you get some rest. So I would definitely say get all the help you can get, because one baby is can be challenging. So two can you definitely need help. So get all the help you need. If you need to hire help, do that as well.
Well, the wind's really getting up here, and it's actually that hour went really quickly.
Yeah.
Thank you so much. I can't see any more questions in the chat, so I'm just going to say thank you to everybody for attending. Thank you for the help for the team. So Chiara De Michele, Julie Gunn, Elle Taylor, and Rihanna Khan. I really appreciate the help that you've given with the conference, and I'm looking forward to tomorrow in some ways. And tomorrow's also going to be a bit of a sad day, because it's about how the mental health of our young people has been affected over the last 2.5 years. But we will be talking about what can be done to help our young people process the trauma and move on. So I'm looking forward to everyone who has tickets, seeing everyone who has tickets for tomorrow. And thank you so much for joining us today. Really nice to see everybody. Take care and have a good rest of the day.
Thank you, you too.